Do you remember when you were a little kid and you couldn't wait to get older? Right? You remember? Maybe you were 4 or 5 and you thought, gosh, I can't wait to be 6 or 7 or maybe 8, right? And it was all this hopefulness and this idea that the older you got, the more you got to do, right? The more independent you were, right? The more, you could do things, you could play baseball or go on rides or whatever. But at some point that changed. Because I don't think I've ever heard a 30-year-old say, I can't wait to be 69, right? Or 78, or 84, right? So there's a difference there, isn't there? And as a matter of fact, a lot of us actually dread getting older. We worry that we're going to have stiffness and aches and pains, and we won't be able to do the things that we love to do. It's kind of the opposite, right? And we worry about our dogs too, right? We worry when they're starting to get older. Maybe they're developing arthritis or hip dysplasia or many different things as they age. So what I'd like to tell you today is that there's a lot more under your control than you realize. There's a lot we can do to really be active in the aging process and minimize the downside of aging, okay? And I'll tell you a little story. There's this dog named Cassie, and Cassie was a fairly big dog, 70 pounds, pure white, and a mixed breed dog. And she was at the park one day with her person. Her person's name is Michelle. And Cassie loved to chase squirrels. So she took off chasing a squirrel across the park. And what Cassie didn't realize was she was in a fenced-in baseball diamond. And unfortunately, she just kept chasing that squirrel in a blind run and right into the chain link fence. Right? Really bad. So Michelle ran over to her, and she saw that Cassie was stunned, but otherwise okay. She was okay. So Michelle took a few minutes and then said, okay, let's start walking home, because they lived near the park, they could just walk. So Cassie, she usually had this pretty effortless trot, but she started getting slower and slower until finally she just plopped down on the sidewalk and didn't want to move. So Michelle thought, well, it's a really hot day, and she's been running. She's probably just hot and tired. So she gave her some time, and after a few minutes, she coaxed her up, and they slowly made their way home. But once they got home, Cassie did the same thing. She plopped down on the floor, and she wouldn't move. So Michelle was like, oh boy, this is something else. So she was able to take her into the car and rush her to the vet. And the first thing the vet did was, when he heard the story about her hitting the fence, he opened up her mouth and he saw that her gums were bloody and shredded. Yeah, so she had hit really head on. So he said, okay, we have to x-ray her neck, right? Make sure she didn't really damage her neck. So they x-rayed her neck, and the x-rays were fine, luckily, fine. So he gave her an injection for inflammation and pain and sent her home with pain pills. So Cassie seemed okay. A day or so later, though, she went down again. Couldn't move. Michelle rushed her to the vet. The vet said, okay, we're dealing with something else besides her neck, because her neck was okay. So this time he x-rayed her whole spine and her hips. And what he discovered was Cassie had a lot of spinal arthritis, which dogs get just like people get. She had really big arthritic lesions in her lumbar spine. And he said, oh boy, this is the problem. This is what's happening. Now, it doesn't mean that the arthritis developed the day she hit the fence, right? It had been there brewing all along, hidden just below the surface. But when she had that trauma, it brought it to the surface, right? And became a problem. So she wasn't responsive at all to the medications he tried. She kept going down. So he said the only thing we could do is we could do surgery, and it's very risky. She could become incontinent or she could be paralyzed, and I have no guarantees that this is going to help her. So Michelle thought, that's not such a good risk, right? So Michelle started looking around for alternative methods to help her dog. So she went to canine massage therapy, she went to swim therapy, she went to chiropractic, acupuncture, all wonderful, wonderful modalities that can be very helpful. But none of them helped Cassie. So Cassie started actually having more and more of these episodes where she would lie down and be completely unable to move, just not want to move at all. So one of the professionals that she had gone to had recommended me. So she brought Cassie to me, and what I noticed about Cassie was, first of all, she was in pain, right, even with the pain meds, but she was overusing some parts of her back and underusing others. And we do the same thing, right? We overuse parts of our body and underuse other parts. So some parts get a lot of wear and tear. And that ages us, doesn't it? It certainly was aging Cassie. So what I did was, first thing I did was just very light, kind of rhythmic movements with her to help calm her down, to help her realize she was in a safe place, I wasn't going to hurt her, and she started to relax. Then I used my hands very, very gently to remind her how all the parts of her body could help the movements of her spine, okay? So this is something we do in the Feldenkrais work, is we're very much about distribution of effort. So the more parts of you that participate in a movement, the less wear and tear, the less aging, right? So it's a more youthful way to move, to be. So I just very gently, using non-habitual touch, that's important, woke up all these places in her back so she could learn to use her back in a healthier way, in a more efficient way. She could use her ribs, right? And all the different parts of herself. So after we did 2 sessions, and after the second session, I said to Michelle, she's good. She doesn't need to see me anymore. And Michelle said, oh no, this has been going on for months. How could she be okay? Like, you only saw her twice. We're coming back next week. So okay, they came back again. Because, you can always get better, right? You can always improve. Always there's room for improvement. So we did another session. And I'm happy to say Cassie never had another episode of that falling down and not moving after the first time she saw me. She never again. She lived for many years. And Michelle, and I write about her in my book actually, Michelle said, it went from here she thought her dog was pretty much near the end, and she went on to live and to run on the beach and run through that same park again for years. Why? And she never had the surgery, but because she learned to use herself in this more efficient, this healthier way, so she became younger, okay? So that's really, really important, and it's a real important piece of what we do here in the Feldenkrais method, is help you use yourself in a very efficient way. So now you have to wonder, though, why did Cassie get that way? Why did she use herself in an unhealthy way? Anybody have a guess?
Habit and activities that she did?
Exactly, habits. You said habits, yes?
Yes.
Habits. We all have habits. And sometimes those habits work against us. They usually start because there's a valid reason for a habit. Maybe she was protecting something. Maybe she had gotten injured a long time ago and she was protecting a part of herself, right? For example, if you hurt your left foot and you limp for a while, right? That's a pretty good solution, right? If my foot is hurt. But once that heals, you might have what I call an echo of a limp, right? That maybe you're just tilting your pelvis a little bit or holding in the rib cage or something else. Maybe one shoulder gets higher because you're kind of compensating a little bit. And when you don't let that go, over time, it could lead to a bigger problem. So we don't know the cause of Cassie's, habit of why she did that. But just so you can experience this yourselves, if everyone would please interlace their fingers. Just interlace your fingers. And how many of you have the right thumb on top? Okay, so I assume the rest of you have the left thumb on top. Now, if everyone would slide their fingers over so the other thumb is on top, it's important you slide all the fingers over. How does that feel? Yeah, weird, right? One of my students said it feels like holding hands with a stranger. Isn't that good? Isn't that good? So now that's just a habit. Some of us had the right thumb on top and we're perfectly happy with it. And others had the left and that felt normal and natural. So that's an example of a habit. But we also have habits about how we use our low back and pelvis, for example, right? How we hold the muscles around our hips, maybe what we do with our shoulders, how we hold our head and neck. These are all habits that we've developed over time. And they're either helping us, right? Or, like in Cassie's case, they're actually harming us. So it's really important that you figure out what you're doing, so as Moshe said, so you can know what you want to do. So you're able to do what you want to do. So let's talk about a couple of things you can do to change your habits. So if everyone would sit forward in the chair a little bit. And if anyone has a jacket with them or a sweater or something, if I can ask you to take it off and put it on. And if anyone wants to borrow my jacket, and I have a reason for saying this. Anybody want a jacket? Eleanor? Pay attention to how you put it on, which arm you put in first. Yeah, it has to be a jacket. Well, that might work, but that won't be the same as like a, yeah, because we're really going to talk about which arm you put in first. And then do the other, right? Did you try? No. So yeah, if you have a vest would work too. That's it. Isn't it weird? I know. Did you try it, hon?
I think the right one. No,
okay. No, you can't. Yeah. Isn't it funny? So, okay, I'll tell you a funny story about this. So how many felt weird putting it on the other way? Weird, right? It's like crazy weird. But think of what you have to do. There's side bending. There's all these things involved when you're putting on a shirt or a jacket, right? And we get so habitual about how we do it. And it's almost like, how else would I do it, right? And so it'll open up a whole window into learning to use yourself better, okay? I'll tell you a funny story. So I was teaching a 2-day workshop for horses and riders. I saw a little while ago. And on the morning of the second day, I asked the group if they had any comments or questions about what we did the day before. So this gentleman raises his hand. And he was a real cowboy. He had the cowboy hat. He had the big silver buckle. He had the cowboy boots. And he said, Mary, I was putting on my pants this morning and I couldn't stop thinking about you. And And I was standing there thinking, where's he going with this? Like, I don't know. So, he was a big, handsome dude, too. And then he went on, mercifully, to say, I realize I always put my pants on with my right leg first. And because I had told them that the day before to explore that, right? So, he said it was so difficult to put it on with the left. And so think about that. We have a whole way of moving. Like we may go up the stairs, always using, say, the right leg first. I see that a lot. And it's so funny because a stairway can be over there, and you walk to it, and your stride automatically adjusts that you're going to go off on that leg. Right? Have you noticed that? Now, these are all things that over time can actually aid you. Right? If you're overusing certain parts and underusing others, creates much more wear and tear. And the dogs do similar things. They get into habits, right? They might always go in a certain direction, like we talked about, right? So that means a certain lead. They're using their body asymmetrically, and over time, it's very damaging. So I would invite you to explore things like that, how you put your clothes on and off, and if you could vary it. It really gets you thinking. And even more important than that, it wakes up the brain in a different way, creates new neural connections, right? That's very rejuvenating. So really learning what your habits are and deciding to say, I'm going to be curious about that and see how else I can do it. That is really, really helpful. Now with dogs, there's things you can do differently as well. I was talking to this lovely couple here earlier, and they were saying how, was it when you play fetch, the dog always goes? Toss the ball.
Route that's always clockwise.
Always clockwise. So the dog always runs clockwise, right? So you need to so we talked about, you need to change that up, yes. Right? But even things like, a lot of people, they'll, when they walk their dogs, they'll always have the dog on their left, for example. Horse on the right, dog on the left. That's tradition. But I usually tell people, unless you're competing, teach the dog to go either side. Because otherwise you really get a one-sided dog, So things like that are really important. And for you, for the human, even when you pet your dog, petting with a non-dominant hand can be interesting. Attaching the harness and the leash with the non-dominant hand. Doing new activities with your dog, teaching your dog a new skill, learning, positive reinforcement training, all things that get your mind going, stimulate you as well as the dog. So it's super important to do stuff like that. Again, we get so habitual in our movements and in our thinking, and that can really age us. That make sense? So I'll give you another example of a dog I helped with a different situation. This dog had a hamstring injury, and the vet had said, it's soft tissue, the dog will be fine. But several weeks passed and the dog wasn't fine. Brought the dog back to the vet, and the vet said, it's a soft tissue injury, I don't know why it's not healing, but nothing I can do. So then someone told them about this work, and they brought the dog to me, and he was one of those big, friendly boxers that just like bowls you over when he sees you, with the tongue and the ears and the whole thing. He was great. His name is Otis. And Odie, what I noticed about him is his whole back was very tight. Now you think, well, what does that have to do with the hamstrings, right? The dog's hamstrings are in the back, right, like our hamstrings. Has a lot to do with the back, right? If the back is tight, creates tension in the hamstrings. So I didn't massage his hamstrings What I did was I helped him feel how he could use his back in a better way. I helped him release the tension in his back, reminded him, for example, that the chest helps in rounding and arching the back. So important for us, and it's so important for animals. Big, big thing. The chest, that means the sternum and the ribs, softens when the dog rounds his back and comes up when they arch. If they don't do that, and a lot of them don't, you get a lot of wear and tear damage in the spine, same as with us. So that's one of the things that will age a human and age a dog, or a horse for that matter. So Odie was another one. I saw him twice, and his hamstring injury completely went away because he learned to use himself in a healthier way that allowed the hamstring to release. Right? He didn't need to keep it so clenched. Gave him an opportunity to heal. That makes sense? So just to give you a little example of what I mean by softening the chest, if everyone would just come a little forward in their chairs, please, with the feet flat on the ground. And just take your right hand and slide it down your right leg and up again. And do that a few times, very slowly though. Very slowly though. And really think about your chest softening as you do that. Your sternum and ribs going down. You could even take your other hand, your left hand, and press a little bit on your sternum. Down. So down towards your feet. Down, that's it, down towards the pubic bone. Can you feel your chest folding and softening? And then allow the sternum and ribs to come up when you lengthen and come to sitting. That's it. And then switch hands when you'd like. And really think about the chest softening and the back rounding. Feel how you go onto the back of your sit bones. And then you come forward on them as you sit up. And if you exhale as you round down, you have more softness, more folding in the chest. That's very nice. Very, very good. So feel that. And then you could play and actually have your right hand go on the inside of your left leg. That will change what you do with your chest. That's it. Very slowly so you can feel what you're doing. Very nice. Feel how you can round the back. Exhale as you go down. Inhale as you come up. And switch so that your left hand is now on the inside of the right leg. Go very slowly though. That's it. Very nice. Good, good, good. Okay, and leave it. Lower your hands and just sit in your chairs. Notice if even just those couple of minutes has given you a different appreciation for your chest and your spine. Good. And now as you're sitting comfortably, what I'd like to do is lead you through it's like a little meditation that you can do with your dog. Okay? We're going to have to pretend your dog is around. And if you don't have a dog, you can visualize anyone you wish. But before I go into it, I'll tell you a quick story. Many years ago, this gentleman brought his dog to me. The dog was an 11-year-old Australian Shepherd named Rocky. Real handsome dog. But when Rocky came in, he was dragging his hind legs and just kind of falling. He couldn't walk normally. And that's the reason why Bob brought him to me. And he had done all the veterinary things, but they said, you know, he's old, he's really weak, he has a lot of arthritis, there isn't much you can do. But someone else, one of his neighbors, had brought their dog to me with good results, so he took a chance. So Rocky comes in, And he's such a sweet boy. And he lies down on the mat that was in my office. And I remember this as clear as day, even though it was about 20 years ago. He was lying down on his side, and I just put my hands on his lower back to give him this sense of relief, to really like take over the work of his muscles, to let him feel, oh, I don't have to work so hard. And as I did that, I thought, I am so grateful that this dog put himself literally in my hands. It was just this overwhelming sense of gratitude I had. And as I thought that, it was like an explosion happened in my chest. It was unbelievable. And I thought, wow. And from that moment, I could feel everything that Rocky was feeling. It's like I knew that where I put my hands, whether this was really important to him or not. Like I could feel the difference in my own self. So I did a very technical lesson. I used rollers and what we call artificial floor and all kinds of real fancy stuff. And at the end of the session, the dog got up and walked around the room. So, and this is all thanks to Dr. Moshe Feldenkrais. It was all his genius. I'm just putting it into play. But I kept thinking, I want that feeling again. So when Bob said to me, do I need to bring him back? I said, oh yeah. Yeah. He needs to come back next week. So, because I thought that was unique to Rocky, that feeling I had. It was so delicious. It was amazing. I was like on cloud 9 for all week for that. So he brought Rocky again the next week. And it happened again, but even better than that, I realized I could create that with anyone I worked with. I think Rocky was my, I don't know, some kind of big teacher for sure. But if I entered into that state of pure appreciation, I could get that with anyone. Didn't matter the species or anything. So that's what I started doing, and I teach this work. I teach people how to work with animals, and that's the first thing we do is I do something called connected breathing, where you breathe together with your animal, and you really enter into the state of appreciation, which promotes heart rate variability coherence. Right? It's a really wonderful state. It's considered a high performance state. You physically get more powerful. Cardiologists use this a lot to control blood pressure as well as other heart things. It's a wonderful state to be in. And a lot of spiritual teachers say it is our natural state. And it's an amazing stress reliever. And this is what I tell people, even when your dog isn't around, or if your dog has passed over or whatever, you can imagine your dog is with you when you do this. So I have the full meditation available for free on my website. If you can't find it, email me. I'm going to give you a handout so you'll have my email. But it's all for free. But I'll give you a taste of it now. And what I suggest you do is to put your hands over your heart area. And now maybe you want to close your eyes, maybe not, it's up to you. But just start to pay attention to your breath and think of your heart as like a filter, that your breath is going through your heart. And then as you exhale, you can imagine like a beautifully colored light emitting from your body. Whether you want it emitted from every cell or your hands or just from your heart, whatever you'd like. But choose a color. Choose a, really imagine this. So you're going to inhale, think of it going through your heart, coming out, And now send that love to someone. Could be your dog, it could be a human, it could be whoever. You choose. And now this bit is important too. When you inhale again, imagine that whoever you sent that love to is sending that back to you. So you're creating this wonderful virtuous cycle where you're sending and receiving love. And it's really important to do the receiving part, because it's just like, with anything in life, there's a balance, right? To be balanced, you need to give and receive. So much of the time we worry about taking care of others that we don't take the time to feel that love back to us and really embody it. So now we're going to pretend you have a dog or someone in front of you, and you would just put your hands lightly now on the dog's rib cage. So the dog could be right in your lap, let's pretend, so you're not reaching. You could do this on a couch, you could do this on the floor, wherever you'd be comfortable with your dog. But what I tend to do is just put my hands lightly on the rib cage, the dog's rib cage, the chest. And you're just listening to the breath. So yes, you can do it to your own ribs if you'd like, if it's comfortable.
While the dog's lying like that?
The dog could be generally on the side is best, but even if he was lying like on his sternum, you could do it as well. But if they're comfortable lying on their side, that's actually best because they're most relaxed. So just feel the breath. So you can imagine this now if you have a dog in mind. You would just feel the breath. And dogs know the difference between a listening touch and a corrective touch. You're not trying to change the breath. You're just listening to the breath. And again, you want to have this loop, this virtuous cycle of giving and receiving love from your dog or whoever you choose. Could be a cat, could be a human, could be a horse, whoever. Fish, golf, And notice how that lowers your stress. You can't be worried and grateful at the same time. Right? You have to be, right? You're really in the present when you're feeling this sense of gratitude. So that's a wonderful way to start doing some hands-on work with your animal, okay? Now, people have been known, like I said, to do this type of stuff with humans too. So you can go home and do it with your human friends as well. But that's the first step, and I'm going to give you this handout later, whoever would like one. But that's step number one, is to breathe and appreciate with your dog, okay? This is going to be rejuvenating for you as well as your dog. Puts them in a whole different state. There was a woman who attended the festival last year here, and she's a physical therapist. Stacy, you know her. And she had a dog with, the dog had a hip injury and had to have the neck of the femur removed. So she had an FHO, what they call femoral head ostomy. And the dog, even though she healed, would not use the leg. And she tried all kinds of different therapy, and she had the dog doing swim therapy and everything, which was very good. But the dog wouldn't use the leg. And the vet was like, well, the dog should use the leg. There's nothing structurally wrong anymore. She did this. She got my book, and she did that exercise with her dog, and the dog started to use her leg. She sent me a video. Now you think, well, why would that help her learn to use the leg? Well, this is what I've discovered about this. You know when you have a computer problem, and if you don't have someone smart like Ralph around, what do? Either you throw the computer out the window, or you restart it. That solves a lot of problems, right? Just restart. I think of this as like a reset or a restart, that you're giving the body and the brain a chance to let go of all that stuff and just have a clean slate. And it's amazing how powerful this can be. So you can think of it as a little restart or reset. And I think that's why the dog had what I call a global change of state. Instead of being, worried about the leg, the dog was able to get to a place, dog's name is Zoe, that she could just feel herself again, and all that noise in the background dissipated. So it seems simple, but it's a very powerful thing to do with your dog. So whether you have 2 minutes or 10 minutes or whatever, I would really encourage you to do it. And like I said, there's a full explanation and an audio and a video on my site that can lead you through it. That's all free. Step number 2, I would suggest, is to cultivate curiosity. You already did some of that here when we talked about putting the jacket on the different way, putting the pants on differently, noticing how you go up steps, doing things non-habitually with your dog. So just remember my cowboy, right? And think about how you put your clothes on and off. Step number 3 is to embrace ease. This feeling of effortlessness, not having to push for everything, right? Slowing way down. What I tell people is to think about associating pleasure with movement, right? Usually, a lot of times people are working out and they just think, well, this has to feel difficult. No, what if it felt pleasurable? That's going to be rejuvenating because that means you're using yourself in a healthier way. So if a movement feels difficult, whether for you or your dog, chunk it down. And this is where the skills of a Feldenkrais practitioner, of course, come into play. And they can help you a great deal with that, with being able to take movement and break it into like baby steps, right? To chunk it down so that you can do it effortlessly. So embrace that feeling of ease. And you really have to know whether you're just like, you might think, well, I feel okay right now, but do you feel comfortable or does it just feel familiar to you? There's a difference. So really think about that, and the slower you go, the less effort, the more you will feel. So again, you want to associate movement with pleasure for you and your dog, because that's what the brain will want to recreate. So getting back to my story about Cassie, if I were to have tried to force movement in her back, I know, isn't he cute, Ellen? She's looking at my little basset hound. What would happen was, if she wasn't ready for that, if it didn't feel pleasurable, she would not have recreated it. Her body would have discarded it and maybe braced even more. So associating it with pleasure is really, really important, extremely powerful stuff, okay? So just to review, breathe and appreciate with your animals, cultivate curiosity both in you and in them, and embrace ease, okay? So as a matter of fact, I'll leave you with one little thing here, a little homework, if you will. Think of one thing you can do differently with your dog today, for those of you that have dogs. If you don't, think of something you can do with another animal or with yourself. What could you do differently? And then email me and let me know if you wish. I'd love to hear from you guys. There's lots of, like I said, free resources on my website. This work is so amazing. I can't thank Dr. Feldenkrais enough and all my wonderful teachers I've had over the years. So I really hope you go out there and, and take advantage of all the wonderful Feldenkrais practitioners we have here. Okay? Quick. So we were talking about, associating movement with pleasure. some of you may have heard, like in dogs, what they call CCL injuries, which is a knee ligament, similar to ACL in people. It's very common, unfortunately, with dogs. And it's one thing that I've seen over and over. So say the dog has the left one, because it's in the hind leg. Their knees are back here, okay? These are wrists up in front. These are knees. So the knee ligament, for example, if it gets ruptured or torn, they may have to have surgery. So, or somehow they also have braces and different things. But what people often do when the dog doesn't want to use the leg after it should have healed, what do? They pick up this leg and make the dog stand on this leg. Don't do that. Instead, there's ways of working with the dog, and I talk about that actually in my book, of how you can make it so it's pleasurable and non-threatening for the dog to stand on that recovered leg, okay? Very, very important. And also to address the compensation in the back, etc. Because if you don't do that, you'll just end up creating more problems. And again, that's something that's going to be very aging for your dog. Your dog will get older faster. So will you. Does that make sense? Okay. Well, thank you so much for your attention. I really appreciate it. Thank you.